Reduce the amount of bad cholesterol in your bloodstream in 5 steps. I'm Dr. Rawat, a physician who studied nutrition at Harvard, has over 25 years of clinical experience as a family physician, founded healthgroupcoaching.com, and is currently writing a book titled Slow Aging, Reverse Disease, and Lose Weight. So perhaps your physician has advised you that you should be reducing the amount of bad cholesterol in your bloodstream, and how exactly should you go about doing it? Just a quick disclaimer here. This video is not meant to be medical advice. The lifestyle and dietary changes that you make as a result of this video may need to be supplemented with medication. That is a decision that would be made with your physician based upon your risk factors, also based upon the extent of cholesterol rise in your bloodstream. But regardless of whether you need medication or not, making lifestyle and dietary changes which will reduce the amount of bad cholesterol in your bloodstream will be beneficial, and that is what we'll be talking about in this video. Firstly, what do we exactly mean when we talk about bad cholesterol? Generally speaking, we are talking about the biomarker in your cholesterol blood result, which is looking at LDL or non-HDL. LDL stands for low density lipoprotein and HDL stands for high density lipoprotein. Having a higher amount of HDL or high density lipoprotein generally correlates with better cardiovascular outcomes, while having a higher amount of LDL or low density lipoprotein correlates with an increased risk of cardiovascular outcomes. Why would LDL be causing cardiovascular disease? Essentially disease which leads to blockages within blood vessels, and it is this blockage within blood vessels which can then lead to atherosclerosis and various manifestations depending on which organ is affected. So if you're getting a lack of blood supply to your heart, that could result in a heart attack. In the brain, that would be a stroke. In the eyes, that could be blindness. Within your private parts, that could be erectile dysfunction. If there is a lack of supply to your kidneys, that could lead to kidney failure. So cardiovascular disease is in fact the most common cause of death in the world, followed by cancer and neurodegenerative diseases. In fact, even with neurodegenerative diseases, particularly dementia, there is a significant amount of atherosclerotic disease which can be contributing. As an example, a good amount of dementia can be vascular dementia, which is in fact the second most cause of dementia after Alzheimer's dementia, and another common cause being Parkinson's or Lewy body dementia. So by reducing your LDL cholesterol, you will be contributing towards not just reducing your risk of a heart attack, stroke, kidney failure, etc., but also reducing your risk of vascular dementia. It is important to note, however, that LDL is not the only risk factor for these conditions. There are various risk factors. These are multifactorial conditions. So reducing weight, reducing blood pressure, reducing sugar, reducing stress, improving sleep, reducing inflammation in the body, not smoking, having a healthy, nutritious diet, all of these things and more contribute towards the risk of cardiovascular disease. And of course, we must not forget that the reason we talk about these factors are because these are modifiable risk factors or factors which you can affect. But there are also unmodifiable risk factors which cannot affect. Often these will be familial or genetic risk factors as well as environmental risk factors. A quick note on environmental risk factors while I'm on this topic. There was a study published about a month ago which demonstrated the presence of microplastics within plaques or blockages within blood vessels. Just an example, just a reminder for us to remember that there can be many changes we can make to our lifestyle. For example, not heating food within plastic containers, not buying food excessively which is processed packaged within plastic containers, to reduce our exposure to microplastics. This is a small example. This is not the only cause of cardiovascular disease, but there are small changes which you can make today, such as carry food and water within glass and steel containers, not heating or microwaving food within plastic containers, doing that in a ceramic bowl. These are small changes you can make today to start reducing the risk of disease in the future. I would also like to quickly talk about why I've made this video today and the other parameters on your cholesterol blood result. If you look at my website, my coaching program and my YouTube channel, you will see that a lot of time is spent talking about various aspects of lifestyle and health. The 8 topics that I coach on my coaching program include causes of obesity and metabolic disease and how to reverse it, intermittent fasting, reversal of 5 specific diseases using lifestyle and diet. These 5 conditions are metabolic syndrome, fatty liver, pre-diabetes, pre-hypertension, and PCOD, a whole food hypernutritious diet, gut microbiome reset, anti-inflammatory diet, sleep, stress, exercise and resistance training, and we also have a session on reversal of skin aging. However, one thing I often find is that despite making all of these changes, patients do see an improvement in various parameters which are beneficial for their health, and these include a reduction in triglyceride levels, an increase in HDL levels, a reduction in 3-month average sugar HbA1c, as well as other markers of insulin resistance such as fasting glucose, reduction in chronic systemic inflammation, and we measure that using CRP, C-reactive protein. However, LDL cholesterol tends to be a bit of a lagging indicator. I often find that clients have improved all of these other markers, but LDL seems to be a bit resistant to change. And it appears that a dietary strategy really needs to be emphasized when trying to reduce cholesterol. And this is why I made this separate video. There is a lot of misinformation online, and there are people who claim that there is no correlation between LDL or bad cholesterol and the risk of atherosclerotic heart disease. This is pure misinformation. There is really good evidence that there is a link between increased LDL cholesterol and risk of heart disease, strokes, and other forms of atherosclerotic disease. What you need to understand is the people making these claims are often not experts in the field. By not being experts in the field, they do not have the knowledge of the whole breadth of scientific evidence linking LDL cholesterol with the risk of disease. When I say the whole breadth of evidence, I'm talking about large but less specific studies, which can often be observational, large cohort studies, as well as small, more specific studies, which could be Mendelian trials and other kinds of mechanistic trials, which make a connection between increased levels of circulating LDL cholesterol and the risk of heart disease. Often these people spreading misinformation will look at one paper or 2 papers and make this broad general assumption, but the scientific consensus, the academic consensus which has been reached on the link between LDL cholesterol as well as heart disease is something which has been arrived at over several decades of scientific evidence, of various types of scientific evidence, as well as the Cox postulates, which is the demonstration of reversal of heart disease as well as reduction in risk of heart disease when cholesterol reducing strategies are employed. And so scientifically there is really no debate that there is a correlation between increased risk of heart disease and other forms of atherosclerotic cardiovascular disease when you have a higher circulating level of LDL or bad cholesterol, and anyone who says otherwise should not be believed. At this point, you may also be thinking, why even bother with lifestyle and dietary changes? Why not just put everyone on a cholesterol reducing medication? And we need to understand that there are pros and cons when we go in for any intervention. As an example, cholesterol reducing medication can lead to certain side effects. These are rare, but can include muscle pains, for example. Also, there is some evidence that in a small subset of patients, insulin resistance can be increased by the use of statins. And so in some ways, you could make one thing better, but another thing slightly worse. And so as long as you are not at high risk of disease, you do not have other factors increasing your risk of disease, and your levels are not particularly high, as is often seen in conditions like familial or genetic hypercholesterolemia, it is definitely worthwhile trying lifestyle dietary changes to reduce cholesterol first before you go down the route of long-term lifelong medication. Now let's get to the 5 steps of reducing your bad cholesterol in your bloodstream. Step number 1. Reduce your intake of foods which contain more saturated fat or bad cholesterol. These are mostly red meats such as beef, lamb, goat, pork, fried foods, solid fats such as coconut oil, palm oil. Note that these are often found in processed foods. So when you're picking up a muffin or other kind of processed food, look out for palm oil and coconut oil. Reducing high-fat dairy products such as cow's milk, butter, ghee. There is one type of dairy product which I highly recommend because of its beneficial impact on your gut microbiome and downstream effects on your metabolism, and that is fermented probiotic dairy. These would be foods such as soft cottage cheese, yogurt, paneer, kefir, etc. These are highly recommended. They will give you sufficient amounts of calcium in your diet. The probiotic will help with your metabolism and gut microbiome. I do not feel that adults above the age of 20 to 25 really need to take any other form of dairy. You could easily swap your cow's milk for soya milk. Soya milk independently has been shown to reduce your cholesterol levels. It also contains fiber, which will reduce cholesterol levels, and it also contains isoflavonoids, which have been shown to reduce risk of breast cancer, for example. So once you're above the age of 20-25, it's definitely a good call to swap cow's milk for something like soya milk. But if you don't like the taste of soya milk, you could always go for some other kind of nut milk, such as almond milk or cashew milk. So you really need to visualize the kind of changes you'll be making. Next time you go to a restaurant, instead of ordering a beef burger, order that salmon salad. Next time you're having a snack, instead of having a muffin, instead have nuts like walnuts, pistachios, or almonds. Next time you're having breakfast, instead of having sausages and bacon, replace that with omega-3 enriched eggs, sourdough bread with flax seeds, Greek yogurt with fruits, chia seeds, pumpkin seeds, etc. You really need to visualize the changes that you'll be making to your diet and lifestyle. Step number 2 is to increase the amount of polyunsaturated and monounsaturated fats in your diet. These are also called good fats. These are mostly in fish, avocados, olives, nuts, and seeds. I would like to point out that omega-3, which is essentially DHA and EPA, is primarily found in fish and seafood. Plant-based food which contain unsaturated fats primarily contain ALA or alpha-linoleic acid. Now some of this is converted into EPA and DHA in the factor of 1 to 10% depending upon a genetic predilection to converting ALA into EPA and DHA. However, most of the clinical evidence of reducing your risk of dementia, heart disease, as well as blindness, macular degeneration is for EPA and DHA. EPA particularly for heart disease, DHA particularly for reducing risk of blindness and dementia as we get older. And so if you are someone who's vegan or vegetarian and is not able to eat fish, then you may well be deficient in omega-3, and it may well be an option for you to take an omega-3 supplement. This could be fish-based or also plant-based, because fish get their omega-3 from plankton and algae within the ocean, and there are omega-3s which are sourced from plants as well. On my websites, I will very soon be listing my recommended supplements, so look out for that. Step number 3 is to increase the amount of fiber. Fiber is like a mop or sponge in your gut which soaks up sugar and cholesterol, so reduces the absorption of sugar and cholesterol. It also then feeds your gut microbiome and improves your metabolism. So fiber is a really important hack for improving your health in various ways. You can increase fiber by going for more whole intact grains. So the kinds of grains I recommend are brown rice, millets, quinoa, steel cut or whole flake, large flake, 5-minute oats. These contain good amounts of fiber. Also increase consumption of green leafy vegetables and fruits. Fruits also contain pectins, which are also shown to reduce cholesterol levels. Increasing the amount of legumes, lentils, beans also contains both fiber as well as protein, and this is also beneficial for reducing cholesterol. So if you visualize an ideal meal, for example, this would be the kind of meal that your typical gym bro suggests to you when you're on a cut, and this would be something like steamed vegetables, broccoli, cauliflower, cabbage, spinach, kale, along with a healthy protein such as salmon or beans. You may be wondering about eggs. Eggs are a bit like beans and nuts. These are designed to lead to the growth of an entire animal or an entire plant in the case of nuts and seeds, and therefore these are power packed with minerals and all kinds of nutritious items. It is deemed healthy to eat up to 2 eggs in a day. Anything more than that may be excessive egg yolk, and you may want to then have egg white if you're having more than 2 eggs in a day. Also, the way that you make an egg can have an effect. So if you're frying it, then you will be increasing the amount of bad cholesterol, while if you're boiling the egg, you'll be eating it in a more healthy fashion. Of course, I always recommend omega-3 enriched eggs along with a omega-3 enriched bread. Step number 4 to reduce the bad cholesterol in your bloodstream is to simply burn more fat. And this can be done primarily in 2 ways. One is the active way to do it, and the other one is the inactive way to do it. The active way to burn more fat is to do more cardio, to sweat more, and utilize more energy. The inactive, or you could even say lazy way of burning fat, is to do intermittent fasting. If you don't eat food, as the levels of sugar go down in your bloodstream, eventually you will have to burn more fat. I have done videos on the optimal pattern of intermittent fasting. I would highly recommend you check it out. But essentially I recommend ETRF, or early time restricted feeding, which is also called circadian fasting or chrononutrition, essentially matching your eating window with the time when you're more active and matching your fasting window at a time when you are less active, when you are more insulin resistant, when the levels of melatonin in your bloodstream is higher, which increases your insulin resistance. So not eating at a time when you're more likely to store energy, and eating at a time when you're more likely to burn energy. This would be a pattern where you wake up with sunrise, you eat within 1 to 2 hours of waking up, and you do not eat for 14 hours before that. So as an example, if you wake up at 7 o'clock in the morning, you have breakfast between 8 and 9, but you also ensure that you do not have any food after 6 to 7 p.m. at night. And so after that, when you're fasting, you're only allowed green tea, water, and you could have diet 0 sugar, 0 calorie sodas as well. And the 5th way of reducing bad cholesterol in your bloodstream is to simply lose weight. Now, hopefully by doing all the things that I have advised you on in the first 4 steps will help you lose weight. If you are more strict with a whole food diet, so avoiding ultra processed foods and choosing more real food options in your diet, along with early time restricted feeding, reducing stress, improving sleep, increasing exercise, walking at least 10,000 steps per day, having exercise snacks, all these strategies will help you lose weight. And as you lose weight, you will find that your cholesterol will come down as well. Now, why could this be the case? And I will illustrate this by the observation that often teenagers and young people will have a very unhealthy diet but normal cholesterol. So why is it that these teenagers can eat fried Mac burgers all day and still get away with normal cholesterol in their blood results? This is because they have a very efficient system. Their system is able to clear the cholesterol very effectively. In our body, the job of clearing cholesterol from the bloodstream is that of your liver. Your liver is like a sponge. All of your blood passes through the liver and it soaks up the cholesterol within the bloodstream. It then packages it up, mixes it into bile, and then it goes into your gut, and then your gut then decides to what extent it needs to reabsorb the cholesterol depending upon your requirements, and to what extent it can then excrete that cholesterol. And in fact, there are certain drugs such as ezetimibe which reduce the reabsorption of cholesterol, and that is how those drugs work. In any case, your liver needs to be clean and functioning well to keep clearing that cholesterol from your bloodstream. So you could describe those teenagers and young people as that car which is just rolled out of the showroom. The carburetor and other filters within the engine are spanking clean. They are very effective. But as we get older, as more and more blood and sludge has been passing through that sponge, which is your liver, more of that starts depositing within the liver. Often we will call this fatty liver or fatty changes within the liver. And in some cases, you may not officially have fatty liver, but as you are growing older, it is but natural that if you are gaining weight, particularly if you have more fat around your belt line, you will start to have more sludge depositing within that liver. That liver of yours is like the filter or carburetor in your car engine. As it starts to get more packed up with soot in the case of the car filter, or packed up with fat in the case of your liver, it becomes less effective. It's like a sponge which is already full, and a full sponge cannot absorb more water. Hence, you get more LDL bad fats staying in the bloodstream because they're not getting absorbed. If you lose weight, if your belt size comes down, and if you're able to burn more fat from the liver, and I would highly recommend you watch my previous video on how to reverse fatty liver, in which you will see dietary, lifestyle, as well as supplement recommendations for how to burn more fat from your liver. Then your liver will become more effective at clearing the cholesterol out of your bloodstream. So to summarize, the 5 ways of reducing cholesterol are to reduce your intake of saturated fats or bad cholesterol, increase your intake of unsaturated fats or good cholesterol, increase your intake of fiber, burn more fat through cardio exercises and intermittent fasting, and 5th, reduce weight, particularly your belt size or fat depositing around the waist. 2 things which are often cited in medical literature and academic literature which I did not recommend, and I would like to quickly just touch upon those topics. It is often cited, and you can look at the article from Harvard Publishing Press on how to reduce cholesterol, which also recommend the use of plant-based oils such as olive oil to reduce cholesterol, because these do contain more unsaturated fats, as well as the use of margarines which contain plant stenols and sterols to reduce cholesterol. I do not specifically recommend these 2 things, and the reason I do not specifically recommend these 2 steps is because these are 2 foods which are high calorie density processed foods. And on my coaching program at healthgroupcoaching.com, I'm very specific that I would like my clients to follow a whole food diet. I would rather that you eat an olive than have olive oil. I would rather that you eat plants than have plant stenols and plant sterols within a margarine, which is a processed item. The biggest problem with eating processed foods is that they are high calorie density, but they do not provide satiety. They do not provide bulking in your stomach. They do not contain fiber, water, or a food matrix. The energy density is higher, but the satiety score is lower. You will be able to get many more calories by drinking olive oil than by eating olives. Similarly, you'd be getting a lot more calories by drinking apple juice than eating apples. A glass of apple juice could contain 6 to 8 apples. 6 to 8 apples would provide you with a lot of fiber and a lot of water and would make you feel full. You'd probably not be able to eat for a good few hours. On the other hand, a glass of apple juice would give you the same number of calories but would not give you satiety, and as a result, overall, you would be able to consume more calories. And so while apple juice and olive oil per se are not unhealthy, they are high calorie density processed foods. As a result, you will consume more calories, you will gain more weight. And as we discussed, gaining weight in itself can independently increase your cholesterol levels. So while in the short term these may appear to be beneficial, and here I'm talking about olive oil and also talking about plant stenols and sterols within margarine, because these are processed high calorie density foods, in the longer term they would lead to weight gain, which would then lead to higher cholesterol. So on that, I disagree with the academic suggestion of using oils and margarines to reduce your cholesterol. There is one more hack we use for trying to lose weight, which is the thermic effect of food. This is the amount of energy that your body has to utilize to break down that food and absorb that food. As an example, if you're eating beans or some high quality proteins, then the thermic effect of food is about 30%. If you eat 100 calories of that protein, then you would only absorb 70%, because 30% of those calories would actually get utilized for breaking down that protein into amino acids, then reassembling it into the constituent amino acids or protein that you require in your body. That could be collagen or skin or muscle. And hence the total amount of calories you absorb from that food is less than what was on the label. One more thing is the absorption of food. There was a study which showed that if you eat whole nuts compared to nut butter, then 30% of those whole nuts will be present in the stool, so they could not get absorbed. Because those were whole, the body only had a certain amount of time as it was passing through the alimentary canal to break it down and absorb it. And because it's whole, it has a food matrix which needs to be broken down. The body is unable to break it all down. So 30% is in the stool, which means you only absorb 70% of those nuts. So since it had protein, the thermic effect was about 30%. Because it was whole, then all of it didn't get absorbed. And this is why I'm not a big fan of food labels, because on a food label, the nut butter and the whole nut would have the same amount of calories, but you would absorb 30% less of the whole nut. Also, your body would need to spend 30% of that energy to absorb that nut and break it down, which means that the total calorie intake is about 50% approximately compared to having that nut butter, which is why I'm a big proponent of a whole food diet, which is also why I do not recommend a strategy of using processed foods like olive oil and margarine in an attempt to reduce cholesterol, even though in the short term they may lead to reduction in LDL cholesterol. In the long term, processed foods which have high energy density and a low thermic effect will lead to weight gain, and in the longer term that will go against what we're trying to achieve. I hope you found the video useful. Do share it with friends and family who may benefit from this information. If you're interested in receiving coaching from me one-to-one in a group Zoom setting, then considering visiting my website healthgroupcoaching.com. I coach clients on 8 topics over 4 weeks. These are done on Zoom in a group video setting at 8:30 p.m. Eastern Time on Tuesdays and Thursdays. We're starting a new batch in June, so if you're interested, check out the website and sign up. There is a free sign up option on the website as well, and this can be beneficial if you do not want to join me one-to-one within that Zoom meeting. You can get recordings of those Zoom meetings emailed to you if you are signed up as a free member on the website, and this may be a good way for you to just dip your toes and see if this is something for you or not. Otherwise, at the minimum, you can subscribe to the YouTube channel and you will be getting informative information on how to improve health. Our mission on the website is to slow aging, reverse metabolic disease, and lose weight. Make sure you subscribe and also hit the notification bell because I will be doing future videos on reversal of metabolic conditions such as pre-hypertension, metabolic syndrome and PCOD. If you'd like to watch my previous videos on how to reverse pre-diabetes and fatty liver, then click on the links above. Take care everyone, and I'll see you at the next video.